My name is Vincenzo di Marzo. I'm a research director at the National Research Council of Italy, and my institute is in near Naples in the south of Italy. And I've been working on the endocannabinoid system now since 1994, so it's nearly 20 years, and it's really, I've dedicated my life, half of my professional life to this theme.
Tell me, sir, you've mentioned about that cannabinoids are neuroprotective. I was wondering if you could tell us a little bit about what you mean, elaborate on that a little bit more in layman's
Well,
terms.
first of all, I would like to stress the fact that cannabinoids and endocannabinoids are not really the same thing. They're both complex, but in different ways. Endocannabinoids were discovered thanks to studies on cannabinoids, particularly on THC. But once we discovered them, we found that, among other things, they also act on the same receptors and the same molecular targets as THC, but they also act in other ways. And one thing is giving a cannabinoid exogenously, like THC exogenously as a medicine. One thing is to boost the endocannabinoid system, and this second way basically preserves the selectivity through which endocannabinoids work when they play in a healthy person a protective function to to help maintaining the homeostasis of the cell. So in this sense, endocannabinoids are protective, they are neuroprotective, they can be protective against other types of cellular stresses or stressors. Exogenous cannabinoids can be protective, but can also not be protective simply because when you take a cannabinoid as a medicine, it may act on cannabinoid receptors that are located in cells where their activation of these receptors is protective, but the exogenous cannabinoid can also act on cannabinoid receptors in cells where this activation is not protective. It could be even counterprotective. Whereas endocannabinoids, being endogenous modulators, they, I repeat, when everything works well, when the system works well, they're usually there to play a pro-homeostatic protective function.
I see. What do you see as the role, really, of the natural plant of cannabinoids, though, in that regard? Is this primarily as a supplement?
You mean plant cannabinoids?
Yeah, plant-based.
Well, no, I don't think it's just going to be supplements. First of all, not all cannabinoids are alike. THC has a more understood mechanism of action. We know that THC acts mostly on cannabinoid receptors, CB1 and CB2 receptors. Other cannabinoids do not activate very potently the cannabinoid receptors like CB1 or CB2. They act via more than one mechanism of action. I personally favor drugs, be them natural or synthetic, that activate more than one target, because these, with some luck, can mean more efficacy and less side effects, contrary to what it was thought until some time ago. So I still hope that from cannabinoids, plant cannabinoids, one can make good medicines, not just THC, but also the others. There's over 70, and we just need to do more work to understand what type of mechanism they act through, what type of indications they can be used to, and in some cases we have already evidence that these other cannabinoids that have been less studied and are much less abundant in the normal cannabis plant, in the normal cannabis strain, we know that they may act also by interfering, by modulating the endocannabinoid system, but some of these cannabinoids, unlike THC, also act on other systems, and this could be a complication, but will also be a good point, an added plus value for their potential therapeutic applications. So it's important to see whether, we need to decide whether it's better to give one of them, to give a mixture of them. This really needs to be studied.
Again, I'm sorry, I do ask about the natural plant. Quite
Yeah,
often,
sure.
You know, from a
Understand.
layman's standpoint,
Yes.
of course. But I'm curious, do you find it's the interaction between the different, particularly when you're talking about the plant-based cannabinoids, the interaction between multiple cannabinoids that are more beneficial than specific individual?
Well, we really don't know the answer to this question, because so far the cannabinoids have been mostly studied one by one. I mean, with a single administration of THC, say for example dronabinol, but also synthetic analogs of THC like nabilone, single administration of CBD. The other cannabinoids I was referring to that basically have not been studied because they're so scarce in the plant that it's difficult to prepare them. There has been very little interest in synthesizing them, so we don't have synthetic sources. So as a basic scientist, my approach would be to test them one by one, to test purified compounds, synthetic or natural as well, if one can purify them from the plant in a sufficient way, and then see if they can also act better in a more beneficial way when given in combinations. There is one single example of a combination which is Sativex and seems to be working. So maybe based on that example, there will be more medicines like that.
Do you see the plant-based cannabinoids as a springboard to other medicines, or do you see that it has continue and have a role in these new?
This is an important question. Many people are questioning whether THC or cannabidiol or the other compounds that are emerging like cannabichromine, cannabigerol, tetrahydrocannabivarin, whether they should be given as the main drug or as add-ons on other drugs. For example, this has been discussed for cancer with cannabidiol. I don't know. I mean, I don't think one should have any preconceived ideas. I mean, these are chemicals. So the only difference is that with other chemicals, with other synthetic chemicals, is that for most of them we don't know much about their pharmacology. For most of them we don't know whether or not they act via the endocannabinoid system, and it's just a matter of really working on them and see if we can. I mean, any drug is a chemical after all. Any classical drug is a chemical, and cannabinoids are chemicals as well. I usually don't favor the idea that natural drugs are better than synthetic drugs. They can be as dangerous as a synthetic drug. We need to study them and to see what happens with them. But other than that, I would say that cannabinoids so far have been safe. There has been quite a lot of studies on cannabidiol, for example, and it's definitely seems to be a good drug with several potential therapeutic implications. I wouldn't think that just because these are natural compounds, one should consider them as supplements or as to be given to administered together with other big pharma compounds.
You've made this statement, and it's been repeated many times, that relax, eat, rest, forget, protect. If you wouldn't mind, please, could you elaborate?
Well, that was simply based on, that was 1998 when I wrote that, and so I was referring on to the endocannabinoids. What could their role be, their general strategy of action? Could they be involved in stress? Well, from what we knew about THC at that time, the answer is yes. And then this prediction was basically confirmed. Definitely these are endogenous molecules that are produced during stressful conditions, either at the isolated cell level but also at the whole organism level. And they seem to be producing those effects. Of course, that concept was very simplistic. Now we know more about each of those potential function, protection, relaxing. I mean, it's a kind of fight or flight system that maybe has been evolutionarily conserved to combat the consequences of stress and to recover from stress more quickly as possible. So I would still say that that concept is valid, even though it's not so simple as it may have looked in 1998.
With the rising concerns over post-traumatic stress in particular, what role do you see here?
I would never go for drugs that directly impact on the endocannabinoid system. I would rather go for modulators of the endocannabinoid system in order to preserve the selectivity of its action. It's difficult for an exogenous drug to keep the selectivity that is targeting a certain system, to keep the selectivity of that system when that system is working well. So all drugs so far have been given with the idea that they should either boost or compensate for defects of endogenous systems. This is true to some extent, but on the other hand, we've seen many failures in the pharmaceutical companies of the approach of selectively impacting on one target, on one receptor, on one enzyme. So in the case of post-traumatic stress disorders, I would say that from what we know from the animals, and what I'm talking about now unfortunately is mostly animal studies, preclinical studies, the compounds that have been most successful have been those that inhibit the degradation of the endocannabinoids. I don't remember many studies with THC. Giving THC to an animal is always problematic because you cannot give too much, otherwise you have a sedation, you have locomotor impairment. But then if you don't give enough, you don't see the effect. So it's always been a little problematic. Whereas when you modulate the system from inside using a compound that, for example, inhibits the degradation of the endocannabinoids, in that sense, in animal, if there is an animal model for PTSD, those have worked better than THC, for example. My work has been always to work with the endocannabinoid system. How can we manipulate? I know manipulating is not the right word. It doesn't sound very well. But how can we modulate it so that when it's not working well or is not doing its job, how can we bring it back to do its job? And certainly some pure cannabinoids have been, at least in animal models, have been useful, and THC is one of them, to try to restore the malfunctioning of the or of the insufficient prohomeostatic action of the endocannabinoids. And maybe other non-THC cannabinoids will also be useful in that. There is already evidence for that in animal studies. But other than that, I don't really feel like saying more, because working with animals is already complicated enough. Then working with complex system, complex medicines, it's complicated.
What would you say would be the most exciting thing that you've been exposed to so far during your research?
Oh, well, I mean, this is very personal, of course, but I think the endocannabinoid system is, so far at least, the only endogenous system of chemical signals that is involved in everything. And there have been many failures in the attempts of the pharmaceutical industry, and rimonabant is a typical example, to get drugs, to make drugs out of this system. Because this is a very complicated system, it's very pleiotropic, it works everywhere, and it undergoes changes during nearly physiological conditions, it undergoes changes during acute pathological conditions, chronic pathological conditions. I mean, even during the day, it undergoes changes in the same individual. We analyze the levels of endocannabinoids, and they change during the day. They have seasonal changes. Everything impacts on the endocannabinoid system, both endogenously and exogenously. So it's very complicated to work with, but it's also very exciting because it's involved in everything. And I think, Rafi Meshulam says that this is possibly a kind of immune system. Rather, it's an immune system to protect not so much from proteins and cells like the real immune system, but from other conditions. But exactly like the immune system is easily perturbed, and it's difficult to make drugs out of it. So it's going to take a lot of effort, and we need to abandon the typical magic bullet idea of targeting only one drug, only one receptor, only one enzyme. And in this sense, I think that work on plant cannabinoids is going to be exciting, because they may offer this opportunity. Just rather than designing complicated synthetic drugs, maybe we have already the answer there, and it's just a matter of working harder and harder to understand how these compounds work and how the endogenous system works. So it's very exciting. I don't think there is any other endogenous signaling system like the endocannabinoid system, honestly, so far, which poses many challenges, but it's also gratifying when you get some few successes.
With the ever-rising number of autoimmune disease, do you feel that is, again, this is a personal question again, do you feel that is perhaps caused by environmental conditions, and do you believe that the endocannabinoid system could play the most important role in dealing with that?
There have been studies showing that the endocannabinoid system could be involved in autoimmune disorders, and it could be that exactly like the immune system gets kind of disrupted during these autoimmune disorders, the endocannabinoid system may also be deranged, and we need to devise a way of via reestablishing correct functioning of the endocannabinoid system also work on the autoimmune disorders. Definitely multiple sclerosis seems to be very promising. There have been studies on arthritis. There have been rheumatoid arthritis, of course. What else? I mean, most studies have focused on multiple sclerosis and rheumatoid arthritis. And in both cases, there seems to be some promise in drugs that, at least in animals, that manipulate the endocannabinoid system. And when I say multiple sclerosis, I don't just say the spasticity, the tremors, but also the progress of the disorder. Compounds that manipulate the endocannabinoid system have been in animal models of demyelinating disorders very, very promising. So maybe even in multiple sclerosis, we haven't really seen yet the potential, rather than just lenitive and palliative action of the endocannabinoid system, also maybe a way of retarding the progress, neuroprotective function. And the same for rheumatoid arthritis, and perhaps also for other autoimmune disorders.
In regard to cancers as well?
For cancer, I'm very optimistic, but also I'm aware of the fact that most of the studies have been done in animal models. And the experience tells us that in most cases, what works in animal models doesn't work, unfortunately, in humans. But endocannabinoids, compounds that manipulate endocannabinoid levels, plant cannabinoids, examined as pure compounds, have all been very successful. Combination of THC and CBD has been very successful for some types of tumors. So in animal models seem to be really working well. I would suggest that perhaps considering the seriousness of some disorders, cannabinoids could, and maybe even safe molecules that manipulate the endocannabinoid system could be tested as on top of other treatments for cancer. I'm more optimistic, but I'm also aware that we're out for disappointments there too. I can see that people are really interested in getting to know the science behind this, and this is, I think, very important, because I know that unfortunately the patient has no time. The patient has no time, but research even clinical research and applied research like the one I do takes time, sometimes with very little money from the governments, but among several difficulties. And it's not something that is for us probably, but it's something that's for our children that we hope we're doing. So for that there is hopefully enough time.